it's now my big honor to present to you Dr. Reginald Nalugala from University College Tangaza in Kenya, in Nairobi. And if we speak about localization of vaccine manufacturing, if we speak about localization of data, if we speak about localization, then we need to recognize that in all of these locales, in all of these local places, in all of these local situations, we have different challenges. And Dr. Reginald has really embraced that, and he has found important tools how, from an academic perspective, academia can work with communities, often vulnerable communities, and give from a scientific perspective a pathway to social transformation and the tools that are available to that, among others, through inter-religious dialogue, which is more important than ever if we want to bring these continents of Africa and Europe together. So it's a big honor, Dr. Reginald, to have you here today, and I look forward to your presentation. The floor is yours.
So thank you very much, Professor, for inviting me to speak, and all protocols observed. I would like to go straight to the matter of the day. I work at Tangaza University College. We are a university that is leading social transformation across Africa. We run from a Catholic lens, but we are very global in our approach. There are 22 religious congregations, missionary-led, from all over the world that work here. Most of them have vast experiences from Germany, Netherlands, Italy, Brussels. You go to Canada, USA, Nigeria, Ivory Coast, all that. They're here to address what happens in Africa, that all the time we are bedeviled with conflicts. And then when you're trying to solve conflicts, then the pandemic comes up. Then what do we do? So as a university, we put our students together to reflect and think about the situation that happened in Africa. So we do situation analysis, reflect, and then look for action points. So we collaborate with all the religious groups that we can find in Africa, across the globe. Last year, we organized a big conference where we brought all the religious groups, even those who call themselves atheists, those who don't believe. As long as you are able to contribute to social transformation, we were able to look at these issues that affect Africa: politics, economics, social well-being, the whole about the nexus between theology and human life, the whole question about the dignity of the person. So this is very close to us. So when this pandemic happened, we decided to ask our students, then how do we respond to it? From different perspectives, whether you are from a faith perspective or you work in NGO, how do we respond? And the first impression was, let's understand Africa as part of our research. Let's understand Africa. That since independence, if you look at the map of Africa, there's always war. But are there good images we can also see from Africa? And so we also made reference to what happened in Kenya in 2018, that in opposition leaders and the government, the incumbent president, were able to shake hands. And this was an initiative from faith-based groups who pushed from the side to make sure that there's peace. And that one taught me a very great lesson, that great leaders must be humble and also embrace humility. The nation is greater than individual egos and individual ambitions. And that has become like a model to pass across Africa, that no matter what happens, even if you lose an election, the human person is very important. So don't go to war. So many groups are coming to us in Tangaza asking them, are there other African models that can be promoted in this war on the pandemic to help us bring about the human dignity? So one of the aspects that has come out of research across Africa was to reflect more on what Anna Marriott brought to the fore in November that made Modern Africa Fraternity, with a collaboration with our friends in Europe, to write this letter to World Health Organization, and then the response that made us organize this conference. And Anna Marriott is Oxfam's health policy manager. While speaking on BBC, I was listening very carefully. She criticized vaccine producers for boasting of having experience and expertise of vaccine development, production, and manufacture, life-saving medicine, but had nothing to show how they were helping developing countries have enough doses for their populations. That time, only 3% had been vaccinated across Africa, while some of the rich nations were hoarding vaccines. So what are these lessons we can learn as academics and students in social transformation? So Oxfam had estimated that Pfizer, BioNTech, and Moderna were making pre-tax profits of 34 billion by end of 2021. But they were not sharing these profits with the developing country. So why boast so much? So we tried to analyze this in relation to what we do in terms of peace and security across the continent. So one study by a South African group, Africa Center for Constructive Resolution of Disputes, ACCORD, and they were looking at this nexus between COVID pandemic and security. So they discovered that, of course, Africa is weak in socio-economic outlook for states and citizens, and has been further exacerbated due to the negative impacts of the pandemic. COVID-19 has made disparities in security indices, known as the root causes of conflicts in Africa, more obvious, and also exposed how health issues are intricately interwoven with peace and security. In a press statement that was on 20th of June, 2020, the UN Commission on Peace Building in the Great Lakes region underlined the intersection between COVID-19 pandemic and the disruption of economic activities in key sectors, such as health, education, transport, trade, and tourism. National budgets were put under pressure, making it hard for countries' capacities to cope and address peace and security challenges. Peace builders have recognized the intersection between peace and security, and then health pandemic on the other, and responding in innovative ways to ameliorate the multiplier impacts in the communities. While some of them are strictly adhering to social distancing imperatives of the pandemic and binding time for the pandemic to pass so that they can return to the core peace building mandate, others have adopted themselves to mitigate the impacts of COVID. And in this regard, faith-based groups have been very, very prominent. And last December, we organized a seminar also to address this whole issue affecting the health situation in Africa, and especially in the Horn of Africa. So the stakeholders and networks and institutions, local and international organizations, can work together for the common denominator of resilience and innovations in mobilizing resources for the common good of the affected citizens. So in trying to contribute to capacity development, we as a university, we look at what is it that we value in Africa. So in the Ubuntu spirit, Ubuntu humanity, also the Swahili word Utu, we do not discriminate. And this is always a value that we take seriously in Africa, that we are part of the global circle, and all of us are part of the circle. And once you belong to the circle, you can never discriminate. And then within the African culture imagery of the circle, we also know that the center is very sacred, so nobody can occupy. But then the moment an individual occupies the center, they become dictators, they become oppressors, they become looters, they start looking at the other person as the enemy because they don't want anybody in the center. And that's why in the African imagery, if you say the center belongs to the divine, then everybody respects that. And that's one of the research areas that can help contribute to the global engagement, especially where countries are under stress, experience dictatorship, oppression, extrajudicial killings, extermination of the other. And as Desmond Tutu said, when one person suffers, all of us suffer. Who says that those are the enemies and us are the good ones? And who says that this is the kind of democracy we should embrace because it only serves my people while it's supposed to be holistic in approach? So as Tangaza's university, we create an enabling environment to reach across Africa by nature of us being connected to different countries across the continent. Just this morning, one of my students from Ivory Coast was defending his thesis in the area of climate change and migration. And he was trying to implement this project in northern Uganda. So I told him to visit Professor Mpeza Hingo so that we can work together in developing this. So Tangaza, Kampala International University collaborating to work in Karamoja. And these kind of initiatives are very important because they also bring African countries and students together. So we look for best practices that promote human value and add to the dignity of the person. Because when all of us are together, nobody can be left behind, as the SDGs remind us. So together with the other universities abroad, we have been able to collaborate. We have a very good working relation with the University of Tilburg, and through Tilburg, we have had very good relationship that now we are able to relate in this conference. Our students can participate. Tilburg universities can also work with Tangaza to look across common issues that affect Africa. And so what we have tried to do in the last 2 years is to look at existing challenges in Africa, and especially in the Horn of Africa. We are particularly concerned when governments go to war, and when they go to war, they affect the ordinary people. And ordinary people do not want to fight. So why fight them? So we have had initiatives that bring students from Ethiopia, the Tigray region, Eritrea, Djibouti, Somalia, South Sudan, Khartoum, Uganda, Tanzania, Kenya, to look at this Horn of Africa. What are these conflicts that occur? Where are they coming from? How can we solve them? How can we work together? And this collaboration has also brought us closer to Brussels, where we're able to engage with our partners there. And some of our partners are also connected with other international organizations who can work behind the scenes to promote this important value. And of late, one of the areas we have really been engaged in is migration and refugees, because refugees are very vulnerable, migrants are very vulnerable, and there's been also what they call vaccine discrimination. So as a faith-based institution, we want to see that nobody should be discriminated against accessing vaccine or medicines. And so we also get a lot of good support from the Holy See, who are interested in integral human development. And also, Kenya stands out as a very important global leader, sitting on the UN Security Council, where the president of Kenya has been even acting as the chair, and also the chair of IGAD, Intergovernmental Authority on Development. And because of this, Kenya plays a very big role in peace prospects in the Horn of Africa, and especially what is happening in Ethiopia. And we hope the country of Ethiopia and others can embrace the Kenya spirit of the handshake. The handshake should be firm, where everybody is included, that human beings who are suffering can access medical support, healthcare, and be able to grow the economic well-being. Therefore, we recognize the intersection between peace and security on the other hand, and health pandemic on the other. But then the capacity development has to be developed so that all these initiatives don't go up into smoke. So we call for innovative ways to ameliorate, multiply impacts, balancing peace and security with health and pandemic solutions. Therefore, capacity building for peace in Africa should be taken as a precondition of collaboration among nations across continents and with the donors. Yes, in the 1980s and 90s, as I conclude, was one of the conditionalities for aid was democratization process and good governance. But now with the pandemic, we're saying, oh, come on, let's have peace building. Because if there is peace, then everybody can access medical care and get the support they're looking for. But then also it calls for good governance, where there's transparency, accountability, taking responsibility for our actions, there's participation of everybody in the distribution, and then observance of the many hundreds of rights that are missing in Africa that people can enjoy and access these services. So now peace building is talking over as an important precondition for collaboration with stakeholders in health service delivery in Africa. Thank you very much. That's what I wanted to share very briefly. Thank you.
Thank you very, very much, Dr. Reginald Nalugala from Tangaza University. The center belongs to the divine, I think is the same as saying that we are all incomplete, and is the same as saying to get to greater completeness, we need reverse linkages, as the VC put it. I think we're very much aligned on this seminar here today. And thank you very much, Dr. Reginald, for these important insights that without peace, we cannot collaborate. We need peace for collaboration.